speaker, Dr. Wendy C. The topic is a survey of Asia Pacific Academy of Ophthalmology members' attitudes toward operating room waste and sustainability efforts.
Thank you. Good morning, everyone. I'll be presenting a survey of Asia Pacific Academy of Ophthalmology's APAO's members' attitude towards operating room waste and sustainability efforts. Now, do you know that one phacoemulsification in the UK generates carbon dioxide emission equivalent to driving a car for 500 kilometers? That is 20 times more than a phacoemulsification done in India in Aravind Eye Center. So now that creates a very deep concern regarding our work as ophthalmic surgeon to the environment. Sustainability surveys has been conducted in North America and European in 2020 and 2023 respectively, and they reveal a strong willingness amongst ophthalmic surgeons to adopt a more sustainable practices in the OR. What about the Asia Pacific ophthalmologists? Are we willing to? Hence, to answer that question, a special task force has been formed in 2024, led by all these people, and I thank them sincerely for their guide and support in this project to answer that question. An online survey was distributed to all the members of APAO via emails, February to March this year. The survey, the presentation that I'm presenting is a preliminary data. The survey is currently still ongoing. The survey is available in English and it has been translated to Mandarin and Japanese languages. Similar questionnaires were used from the previous sustainable studies to allow for direct regional comparison. This is our results. So far, we have close to 2,000 respondents, majority from Japan, followed by Indonesia, China, the Philippines, Malaysia, and etc. Majority of the respondents have more than 10 years of experience. They are high-volume cataract surgeons. They work in a public or government hospitals. Majority are male. So this is the result. Close to 94% of the ophthalmologists in Asia Pacific are concerned about global warming and climate change, and this closely mirrors to the result done in the previous study in North America and the European ophthalmologists. So when asked what was the perceived driver of OR waste generated in the OR, 2/3 agrees that manufacturers play an important role in reducing the OR waste. We want the manufacturer should offer more reusable instruments, and that manufacturer should consider the environmental impact in their designing and their packaging. More than 60% agrees that regulatory body should allow surgeons discretion in reusing these medical supplies, and that medical society should advocate for it, and that we do need more clinical studies to prove the safety of reusing these medical items. So this is an interesting data that we have. A higher proportion of respondents in the Asia Pacific are currently reusing these medical supplies as compared to our European friends. More than 60%, 2/3 are currently reusing phaco tips and IA tips. 40% are reusing both the phaco and IA tips. More than half of them are reusing irrigation solutions or bottles for more than one patient. And for those who are currently not reusing, 1 in 5 are willing to consider doing so. The same goes for intraocular pharmaceuticals. And comparison across the regions globally, concerns for endophthalmitis risk and malpractice sustainability significantly reduce the willingness of reusing these supplies. That is very reasonable. And factors such as cost saving and environmental consideration are the factors that increases our willingness to reuse supplies on multiple patients. Factors that drive for single-use instruments are, the major factors are patient safety, performance of the instruments, and we do not want to get sued. So if you could choose between equal functionality, equal performance, and equal cost, 65% of ophthalmologists in the Asia Pacific would prefer to use reusable instruments, 77% in the European region. So in conclusion, the result of this preliminary survey of almost 2,000 respondents closely mirrors to the ones done previously in the European and in North America. More than half of us are already reusing and are willing to reuse these medical supplies and pharmaceuticals, and we rank pretty similarly in terms of the factors that influence our willingness to reuse these supplies. And this adds on and gives a strong consensus that ophthalmologists worldwide are very concerned about global warming and climate change. With that, I thank you.
Thank you. That's a very interesting presentation. We open it up for discussion.
Come again? This survey has run only for a month so far, so this is just a preliminary data. We have close to 2,000 respondents so far. We are pushing through our medical societies. Yeah. We just blasted emails twice through the APAO emails. Yeah.
So did you approach APU for giving you the email database of all the members?
Yes, I did. It's a long way, and translating into Mandarin and Japanese is also a long process, getting it done, and funding, of course.
Of course.
Yeah. To Mandarin and Japanese, and it is available in English. Yeah.
Thank you. We move on to the next